start noticing is like that every human and every condition is different. So I'm gonna get this for you as a quick little model. Typically, what we see in most people is that we see some sort of discompression.
Yeah.
Which is what you probably are having.
Probably.
It's
yeah.
just not enough to be clinically significant, other than when we add aggressive load like 200 pounds, 300 pounds. Mm-hmm. So discompression is essentially just doing this. Squeezing it.
Yeah.
You squeeze too much and the jelly comes out, right? The jelly comes out of the back, it hits the nerve. I'm being a little bit more crude and a little bit more blunt with you because I don't have to
exactly what happens.
Well, I don't have to have that conversation with you because you're not having symptoms of this.
Oh.
So when I tested,
God, it sounds like that though.
but you're having deep compression.
Yeah.
Well, you're stuck at your profession or history of profession is being stuck in a flex state and then loading from here. Yeah. Which is why squats and deadlifts and stuff are important for you.
Back exercises.
But what happens?
That's where it feels like though, right there. See how the pelvic bone sticks out right here?
Like here.
That's definitely that area right there.
So what we can do is we can circle.
Like yeah.
That's where I found that's where when I was touching and poking, I'm like, hey, is it A? Is it B? You're like, it's about the same. Yeah. You were really pointing to right there.
Yeah, probably.
A little bit there. To be honest, you had a little bit of tenderness of here. Yeah. Not just 1 or 2 or A or B, whatever you want to call it. Mm-hmm. But I was testing your sciatic nerve, which a lot of people talk about. Like, hey, I think I have sciatica. You do not have sciatica. Yeah. I was testing the nerve by doing a hamstring stretch and a forward fold test and all these other tests. Yeah. I pulled down on it, nothing problem. There, yeah. When you see where it splits in the road.
And then what's funny is I thought I had that a while ago, so I was doing all the little stretches and stuff to, go like this, twirl your feet, all this weird other stuff, like that. And I was like, well, maybe I don't have that because I don't have any pain in my legs or
that's why I asked
shooting pain going down.
That's why I asked you, do you ever have any shooting pain, numbness, tingling, or burning or anything? You're like, nah. Yeah. And sometimes that goes undiagnosed and people don't know what to listen or look for. Mm-hmm. But that's where me testing you and bringing the leg this way and the leg this way and all these funky things, what I started to do is pull down on each division of the nerves that go down and into the leg, and that actually did not create any issues with you. Yeah. So then you start saying, well, is this person having SI joint pain? I tested your muscles. I tested the hamstring muscles and stuff like that. Yeah. To see if that would be pulling on what we call your pelvis here or the sacrotuberous ligament to see if that would cause some issues within the SI and the dysfunction going up the chain this way. Did not seem like that would cause anything either. Right. I also tested SI joint, what we call shearing, where I kind of pushed back and forth, kind of in this direction. Nothing came up on that. Yeah. So I did heel to butt. I did heel to opposite butt. I did lift your leg from the butt area. I really to help isolate really the pelvic area back here. Yeah. And none of that came up truly positive. Mm-hmm. So what does that mean for you? If you're coming in here, and if I had to say something more bluntly, are you having pain or not? I'd say according to your orthopedic testing, no, you're not having pain. If you couldn't speak to me and tell me that you're having discomfort, I'd say you're probably not having some discomfort.
Yeah.
But this is a good news to have.
You know me.
Right. Yeah, exactly. But you're having if I had to guess again from day one, I think we are on the track of having SI joint pain in dysfunction because you're kind of in this position. Yeah. You might be right leg dominant based off of the heel striking and stuff like that. Mm-hmm. So maybe you're just harder, doing harder extension based work from pedaling in all these years on this area. And I'm coming up with a theory. There's no this is definitive, written in stone. Yeah. I'm just coming up with a theory. One thing I did do on you that tested somewhat interestingly was that last test that I did when I was I kind of had you squat. Yeah. At a certain level, I noticed your posture changed. Now that's going to happen for most people. And your posture changed at the point where you said I started to have discomfort, aka that 80 to 90 degree range. So that here. Yeah. You started to really round forward. Oh, yeah. And really start. And I said, can you go up to here? And you were fine. So then I took that test and that knowledge, and I put you on your back, and I did this. Mm-hmm. Once I start feeling that harder end feel, or that movement into essentially the femur has to keep doing this, right? if your femur on your bike, for example, goes all the way up to here,
yeah,
you know this, because you have to tune up bikes and all this other stuff.
Yeah.
You know that that's not optimal positioning.
Right. Yeah.
Not only is it not optimal positioning, it has to have your pelvis and your hip drop. So I think you actually are losing some hip mobility, believe it or not, more on your left than your right. Maybe because the right is actually hypermobile. That's my theory at this point. And so I'm thinking that if I told you to squat, your hip on the right can go 90 degrees. Probably about right. It's just at that 90 degree where we do this, where the pelvis has to tuck in order to create more more room in the pelvis or in the hip joint. Otherwise, that doesn't work. This side, on the other hand, was more of a lesser angle. So what that looks like from the side is if you were doing a squat, this would be 90.
Yeah.
Roughly. You're like here, in order to, you start doing that, you start really
rounding the back.
And this pelvis starts to do this at an earlier angle, meaning at an angle here.
Okay.
So you can't go into this range. You shouldn't even be able to go to this 90 degree range. You're actually at like here before it starts to hump. And I can show that to you right now in a second. And so you'll start to understand and start feeling, you start to feel what that feels like in your pelvis. And I think just all the years of competitive sports have just wreaked a little bit of havoc, and I think it's just time for a tune-up on that. Adjustments are fine. I think we can do a lot of soft tissue work, which is what I specialize in do. You do have a lot of tight hip flexors and quads. I could just tell from that. From just bringing your leg back and stuff like that. But that's super common in bikers and hockey players and football players, which I see a lot of those guys. Usually bikers, or I'm gonna say bikers like, BMXers, and hockey players have very similar type of issues, SI and groin issues, which you probably know.
Yeah, totally.
Just because I see a lot of that.
Okay.
I think that was it. Any questions on any of that?
Not yet, no.
So what we'll do is we'll go through some cueing and some things. We'll do some soft tissue work. We'll give you some tool sets to go home with so that you can do some exercise. Typically, by the way, when people do low back, sciatica issues, they tend to do worse bending forward and a lot better bending back. But you do okay bending forward until it gets overused, and then you do way worse going back. So right off the bat, just by you telling me that information, I'm going to say no, this is not a disc. This is an SI joint and a pelvic issue.
SI meaning, what is SI?
Sacroiliac.
Okay,
so
that's what that is.
SI joint, sorry, I wasn't clear.
No, that's fine.
Sacroiliac, so this is the sacrum, the bone is the sacrum. This is the ilium, and where the joints meet are here.
Okay,
We call that SI joint, SIJ, or sacroiliac joint.
Okay.
So if we look at that from the front, let's get rid of these ligaments. This would be the joint right there.
Yeah.
This would be the joint on that side. So here's the sacrum again, the ilium, sacroiliac joint.
Okay.
So that's kind of like what these things are.
Yeah.
So I'll show you on your back again.